Hey friends on Facebook and on YouTube, my name is Dr. Zachary Ward. I'm a structural upper cervical chiropractor here in Auburn Hills, Michigan at Life and Alignment Chiropractic. I'm making a video for you today about why alignment matters. It's part of a series of videos I'm making, and today we're talking about maintenance care. We're not going to talk theory, we're going to talk about actuality. We're going to look at one particular patient, a woman in her 70s who originally came in for chronic neck pain. So in front of you is a picture. It says doing nothing isn't a maintenance strategy. I just shared this video, this picture on Facebook not too long ago. Hopefully you can inspect these images of these gears and see the difference between the left and the right and kind of get the metaphor. And the metaphor is trying to communicate this idea is that all mechanical instruments with movable parts require care. It's just a law of nature, just what happens. The spine is made of movable parts, which most people know. They're called joints. And so therefore the argument is the spine requires care as well. And so what does that look like? Let's go ahead and look at it in one particular woman's case. This is an image of an x-ray in front of you. It involves the neck, and it goes up into the upper neck through the mouth, and you have the skull there as well. It kind of looks like that famous painting, The Screamer. What you're seeing there is you're seeing a patient who's sitting in front of my x-ray beam, and they're trying to sit up as tall as they possibly can, but there's a shift of the head over to the left. There's almost a hinging happening right here in the middle of the neck because there's been some trauma, there's been some degeneration, and there's some breakdown. So if I were to draw that kind of hinging in for you, it would look something like this. If we mark the back of the vertebrae, you're going to see some migration of the back of these vertebrae off to the left. If we mark kind of the plane of the vertebrae, we would see that right around in here, these start to rise up on the right side. And so there's almost a hinge that kind of creates what we would call this kind of a list of the neck over here to the left, but it's not happening down in here at the thoracic neck junction. It's actually happening in the middle of the neck. So it's pretty interesting that way. And when I saw that image 3.5 years ago, I did not quite know what to expect in terms of improving that alignment back to the vertical axis within a short time frame. I thought maybe there might be a possibility that it would improve over time, but I wasn't sure about that time frame. So this is the post image of the same patient about 3.5 years later under consistent structural chiropractic care. We'll go ahead and look at both of these images side by side so you can kind of understand the difference between these two. So the image on the left, the before image, we'll go ahead and mark the back of those vertebrae again. Again, you're seeing this kind of migrate off to the left. Image on the right, we're going to mark the back of the vertebrae. And we're going to see that migration does not happen in the same way that it does on the left side. If we look at a vertical axis line or a vertical line going through the middle of that image, middle of the lower neck, and where it goes through the middle of the upper neck, we're going to see that that vertical axis line is far more closer to being superimposed over the middle of that structure on the post image. So in other words, to kind of translate all that from the image to the body position, you're seeing someone who's over here like this, who over time comes back to the vertical axis by receiving pretty consistent structural, very gentle chiropractic care, mostly in the neck. So if we were to get a reason why this matters to this patient, I'm going to bring up just one aspect. There's multiple aspects, but here's one of them. This aspect is that the head is really what's being moved as this neck comes back on the vertical axis. And why that's important is because the head is basically about as large as a bowling ball. So that is a relatively large load for the neck and the upper body and the spine to be responsible for carrying when you're in your awake and upright hours. So as that neck comes from over here, that load is very heavy for that body, for that neck, and as that neck begins to come back to the vertical axis and the head comes with the neck, that load begins to lighten, become more biomechanically normal and advantageous for that patient. So her pain begins to go away, but also as the neck comes back to vertical, it becomes easier for that neck to go through a regeneration process as opposed to a degeneration process because that load from gravity on that head is not as heavy for you or for her. Okay, go ahead and take a look at those images again. Image on the left is the before image. Image on the right is the after image. This is about 3.5 years, relatively consistent chiropractic maintenance care. We're going to say approximately maybe about 10 times per year, where her visits somewhere between 4 and 6 weeks, probably with a few periods here and there where we did not see each other all that often. So doing nothing isn't a maintenance strategy, particularly if you want to take care of your spine and you already have some degeneration and breakdown. If you'd like to learn more about me and my practice, you can go to liachiro.com. If you're in my area, feel free to pick up the telephone and dial this number and get in contact with me that way. If you do like using the website, there is a very handy contact form that you can use, and feel free to reach out and ask any questions about this video. Thank you so much for listening and watching. Have a great day.